there's some thinking that there are serological tests or tests that can determine whether you've had the infection. Maybe you thought you had it and you got past it, or maybe you were asymptomatic. But we should be able to, on a very, very large scale, get tests to determine whether or not you had that infection. Now, non-scientists, non-medical people like me would think, OK, if I get this thing and I get a relatively fast result and it shows that I have antibodies, meaning I had the infection, I'm good to go back to work. Is that naive?
Well, a lot more work needs to be done to determine what level of protective factors or antibodies in your blood would indicate that you're protected from future infection and that you've had this and are safe to go back to work. But I want to get back to that issue of testing and why it's so critically important. What we're talking about is moving from a strategy where everyone is social distancing to one where the public health system needs to identify people very quickly who are infected and sick, isolate them so they can't spread to other people, identify all the people they've come in contact with. That's called contact tracing. And it's one of the oldest methods in public health. And then get those people into quarantine. That means isolated from other people so they're not able to infect people if they become sick. That kind of strategy can prevent the big outbreaks from occurring when we start to loosen some of the social distancing measures. And it would mark a dramatic shift in the approach to this, but the one that would have to come for the next phase in responding to the COVID-19 pandemic.